Hey, hello. Hello, everybody. Welcome to this live session. I'm Dr. Andrea Furlan, and I'm happy that I'm here connecting with you again to chat with you about how to explain your pain to your doctor. This is so important, and I'll tell you why it's important, and then I'll give you some tips about how to explain. Okay. So I'd like to know, where are you watching from? Is my volume okay? I'm not going to touch the microphone today. Last time when I did the live, I touched the microphone and the sound went down. Can someone, maybe Giovanni, can you tell me if the sound is okay on the chat? And I see some people are connected here. I'd love to know, where are you watching from? Hi from Chile. Hi, Disha from Chile. Sound is good. Thank you, Cindy. Sounds great. Excellent. I will not touch the microphone this time. Last time I touched it, I tried to change something here and then the microphone stopped working. Thank you. And if you notice, there is a delay on how the chat works. So if you enter something in the chat, if you type something in the chat, you have to wait 15 seconds to write something again in the chat, because this is to give chance for everybody to write. Okay, so let me see. Wow, we have Steph is from the west coast of Canada. Stephen, perfect timing. You have your first appointment with the doctor on Tuesday. Good. So I hope you can learn. Annette from Texas. Hind from Kuwait. Oh, the other side of the Atlantic. Mohammed, India, Kerala. Oh my God, people from Asia. Ethiopia, from Africa, Genet. Matilda from India. Moshtaba from Iran. Oh, I hope I'm praying for peace for you guys there. Okay. Cindy from the East Coast of Canada. So we have West Coast and East Coast of Canada. Lawrence from Switzerland. And Kissy from the Netherlands, The Hague. I was close to The Hague in August. I went to Amsterdam and I passed by The Hague. Stallion from Romania. Hello. Oh my God, we have a very international group here. Kerala, India. Thank you so much for joining us today. So I'd like to tell you about how to explain your pain to your doctor, right? That's the purpose today. You're all here to get some hints about this. And I'll tell you why I'm decided to do this live on this topic is because a couple of weeks ago on my clinic, the pain clinic where I work, there was a patient and she came to me and she said, it was the first time that I saw her. And she said to me, "Oh, Dr. Furlan, I read your book, the book. I hope you know that I have a book, The 8 Steps to Conquer Chronic Pain." And she said, I read your book and I really liked the method that you explained, the Socrates method, to explain pain to your doctor. And then she said to me, "I'm prepared to use the Socrates method to talk about my pain with you." And I said, "Okay, great. And so tell me everything that you want to tell about your pain." And she went through, this is on page 44 of my book. And so she opened and then she started describing her pain using the Socrates method. And I said, "Oh my God, this is so helpful," because she had all the exact details that I needed to help her, because I need to make a diagnosis. What is this pain? How am I going to help you? I need to know not all pains are the same. I only see people with chronic pain, sometimes acute pain, but chronic pain is not all the same. They can be caused by nociceptive causes, neuropathic, nociplastic. And by knowing the answers to those Socrates questions, it helps me to diagnose the pain. So I was very happy that she used that, and that's why I am here to explain to you the Socrates method. Cindy is saying, you have my book. Love it. Okay, Cindy, so you can open on page 44 and follow me today. So, uh, so that's the first thing why I wanted to do this. But I want to tell you, if you stay until the end, I will tell you something very special about today's date. Today, October 5th, is a very special date in my life. I'm celebrating something today, but I'll tell you at the end. So if you stay until the end, I will tell you why this is so special. Okay. Another thing that I want to tell you is that I activated the super chat for this live. Super chat is that $sign at the bottom of your chat screen. And that is if you want to contribute to this channel, because I am paying an assistant. You may notice that there is a person monitoring the chat, and I have now an employee to help me with my posts on social media, editing my videos. So if you want to help me to grow my channel, I would be very thankful if you send a super chat. And when you send a super chat, your name appears big here, and then I will be drawn to your comment or your question. Just remember this, don't put anything in the chat that is about, I'm not able to give you medical advice here. So don't put your symptoms or your pain. Don't put anything confidential. Don't put your email or telephone number. This is a no. Don't do this because someone else may contact you and pretend that it's me. So I don't want that to happen, okay? So let's talk about the Socrates method. Okay, before, one more thing, before I talk about the Socrates method, I want to know if this time and date is good for you. Do you think that Saturday is good? And I used to do Saturdays 9 or 10 a.m. for me. Now I'm doing it 1 p.m. for me. So I'd like to know if this is a better time and date for you to participate in live. So you can write in the chat if you like this time. Saturday, is it good? And the time, is it good or not? Okay. So yeah, so Giovanni just put there the link. If you don't have the book, that's the link for you to purchase the book. I think that's on Amazon. Okay. So let's talk about the Socrates Method, Socrates. And I prepared a handout for you, okay? I know most of you are members of my website because that's how probably you heard me talking about this live session. So if you are a member of my website, I'll ask Giovanni to put the link to my website. Yeah, it's there, www.drandreafurlan.com. Then you go to the page explaining, and this handout is there. You can download the handout that has the Socrates method. It's also in the book. The book, page 44, has what is the Socrates method. Okay, so let's talk about the S. What is the S in the Socrates method? The S is very important, is where does it hurt? It may look simple. You may say, oh, it's in my arm. But let me tell you this, I copied here. These are real patients, okay? Don't know who they are. But these are patients that I saw over the years, and I printed some of the pain drawings for you to see. So when they come to my clinic, I give this body pain diagram for them, and I ask them, please mark with a pencil or colors, where is the pain? That's the S, the site of the pain, okay? Where does it hurt? This is so important. Sometimes just by looking at this, I already make a diagnosis. For example, like all these people here, all these 4 people, they all had pain in the arms, but the diagnosis is completely different. Okay, let me see. This first one here, you see this? Okay, so this person here marked the hands, and you see here both of the hands, right and left. So this person, what this patient has is Dupuytren's contractures. Dupuytren is a deformity of the hand. It's common in people with diabetes. So the hand contracts and the person cannot straighten the fingers. And that probably affected the nerves of the hand. And so the person has a neuropathic pain of the hand. So that's the first one. You see, so that's a different diagnosis. So we treat this as a neuropathic pain of the hand. Now, the other person here, you see the person here at the bottom of this page also has arm pain. But this person also has back pain, neck pain, abdominal pain, pain in the thighs, both of the knees. So this is a little bit more complicated because now the person has multiple sites of pain, not only the arm, even though the arm was the worst. So this person here may have a myofascial pain, which is muscle pain in many parts of the body. That's what the person had, many sites of myofascial pain. But this person also had central sensitization and some component of nociplastic pain. Okay. Now, this other person also had arm pain. You see, they painted here the outside of the arm and the other side of the arm. But the diagnosis here was different. The diagnosis here was a shoulder impingement. They had a shoulder problem, arthritis and tendinitis of the shoulder, couldn't move the arm, couldn't mobilize the arm. So this was more like a shoulder problem. And the muscles here were radiating. So we will talk about the R in Socrates is radiating pain. So the pain was in the shoulder, but radiating to the arm. So that helped me to say, okay, this person has arm pain, but the problem is coming from the shoulder. And I'll look at the other one here. So this person also has some arm pain, not a lot in the arm, but in the shoulder, legs. So this is widespread pain, and this is more nociplastic pain. This person, we made the diagnosis of nociplastic pain. The pain was sensitizing the whole pain system and developing fibromyalgia. So even a person with fibromyalgia, they may have pain in the arm. So you see the site of pain, S, is, so when you go to the doctor, if the doctor doesn't tell you, give you a pain diagram, you can print one from the internet, or you can print, I think I have on the explaining pain, I have another handout with the pain diagram. So you can bring the pain diagram, paint yourself and bring it to the doctor and say, these are my sites of pain. And try to paint all the sites that you have pain. Sometimes people forget to paint the head and they say, yeah, I have headaches, but they don't paint the head. So paint all the areas. You can paint with different colors or you can paint with a pencil, okay? So that's the S, the site of pain. Now, the O in Socrates, let me see if you have, okay, some people are writing in the comments. Yeah, so that's good. Okay, good. So this is very informative. Yeah, thank you, Razi. Okay, good. The O in the Socrates is the onset of pain. When did the pain start? And most importantly, what were you doing when the pain started? Okay, so tell me, if you tell me now, I know the sites of pain, tell me, was this a pain that started 6 months ago, 20 years ago? Or some people, they say, I don't even remember when the pain started because I had this pain all my life, even when I was a child. So they don't even remember exactly. So that's really important because the longer the person had this pain, it tells me more things. There is some sensitization of the pain system already. So they're already developing some nociplastic pain because having pain for 20, 30, 40 years already probably is sensitizing the pain system. Now, also, what were you doing when the pain started? Like some people, they say, well, my pain started 2 years ago. And it was when I went through a big divorce and it was so stressful. So that might be like having a big event in your life and the pain starts at the same time. Maybe that pain's related to stress. And that's when muscles, we absorb a lot of stress in our muscles. So then it might be myofascial pain or it might be also a nociplastic pain. So that's the O. Okay, good so far? Okay, we know the S and the O. Now, the C is the characteristics of the pain. How does it feel? And it's really helpful if you describe the words like qualitatively, if you give some words that describe the pain, because some types of pain, they are neuropathic pain. They come from nerve injuries, nerve diseases, nerve damage, nerve compression, neuritis, neuralgias. And those kind of pains, they are, when the pain comes from neuropathic pain, they are mostly described as a burning sensation, a tingling sensation, pins and needles, electrical shocks, bursts. They have also, they say, I'm sensitive, like even the fabric rubbing my skin, touching the skin causes pain, and I am kind of it's uncomfortable. Even when the bed sheet rubs my skin, I kind of feel pain. So that tells us that might be some neuropathic component or some nociplastic component, because nociplastic pain also has some hyperalgesia. Okay, but nociceptive pain, which is pain from inflammation, from fracture, they usually are more like an inflamed pain, like a hot, inflamed, achy, heavy. Okay, they may also have sensitivity. If you have an inflamed joint, you don't want to touch around it. The skin around that inflamed joint will be sensitive, but it's different from neuropathic pain, because neuropathic pain will be a bigger area where the area of the nerve is, but there's no inflammation here because it's a disease of the nerve. Are you following me? Okay. Give me some feedback. Yeah. Okay. So Teresa says very helpful. Thank you. Okay. So we saw the S, the O, the C characteristics. So R is for radiating pain. So remember this person here, my patient here that had this pain here in the shoulder, but also this person told me, but my pain also starts here and radiate. So it's really important because radiating pain tells us what is the origin of the pain. So radiating pain can come from the neck, the nerve roots that exit the neck can come from the nerve roots that exit the lumbar spine. Because usually if the nerve root is compressed in the cervical spine or the lumbar spine, they usually don't hurt there. They hurt where that nerve innervates. In the cervical spine, this is called cervical radiculopathy. And I have a video about that on my channel. Okay? So radiating pain. Where does the pain radiate? So that's R. The A, Socra. So the A is associated symptoms, okay? Are there other symptoms that come with this pain? So what other symptoms could be? So the person may have like other symptoms could be, I don't feel the area so well. So this area here is numb. So numbness tells us that probably there is a nerve injury. So numbness. Sometimes they have, if they have a migraine, and migraine is considered a type of chronic pain, they may have nausea, vomiting, light sensitivity, noise sensitivity, smell sensitivity. So are there other symptoms that come with this pain? If they have pain in the neck here, they may have a sensation of if they look up, they may get dizzy, right? If they have abdominal pain or pelvic pain, they may have diarrhea, they may have constipation, other symptoms. So it's really important for us to know. The A is also for ameliorating factors. What makes this pain better? And the E in Socrates, the E is for what makes the pain worse, exacerbating. So A is for ameliorating and E is for exacerbating. So be prepared to answer questions like, what makes your pain worse? What makes your pain better? This is also why that's important. I'll give an example. Okay, before I give you an example, let me tell you, for those of you who came late, that if you stay until the end, I will tell you something really special in my personal life, that why October 5th is so special, okay? But only for those of you who stay to the end. I also activated the super chat, and if you want to contribute financially to this channel, if you contribute to the super chat, there's a $sign on the side of the chat. Your name appears big on the chat, and then this contributes to our channel. Okay, so what makes pain better, what makes pain worse? It's important because if your pain gets better when you apply heat, like a warm compress, a warm towel, a hot pack, or when you take a warm shower, that tells us that probably this pain is coming from muscles, because muscles and tendons, they relax, the pain gets better when you are applying heat. If there is an inflammation, like an arthritis, or an inflammation is when there is inflammatory cells, you can see it's red and big and swollen and hot, then applying ice makes it better. So if you tell me my pain gets better when I apply heat, or my pain gets better when I apply ice, gives me some idea what kind of pain is. Now, if your pain gets worse when you apply heat, or gets worse when you apply ice or something cold, it tells me probably it is neuropathic, because neuropathic pain is a nerve injury, and that nerve injury doesn't like application of ice or heat, because you are stimulating the small fibers and they may irritate even more those nerves. If you tell me also that, oh, my pain gets worse when I am stressed, worried, I'm having a bad day, and then my pain really flares up. So, okay, maybe it's related to stress, because we know stress aggravates pain intensity a lot, because it contracts the muscles, because you get more tense, you release a lot of the stress hormones, adrenaline, cortisol, and they make you feel more pain. So if the pain is related to stress, worry, fear, preoccupation, something going on in your life, or even just watching the news these days, oh my God, just watching the news may aggravate your pain because there's so many bad news these days. So then, okay, maybe it's your muscles that are tensing, or you are releasing too much adrenaline and cortisol. So we need to treat that, because that's very common. Okay, so what makes your pain worse? What makes it better? What kind of medication? If your pain gets better with acetaminophen, anti-inflammatories, it tells us that this pain might be nociceptive or neuropathic pain. Neuropathic pain gets better with anti-inflammatories. If you take opioids and the pain gets better, it's probably either nociceptive or neuropathic. Now, nociplastic pain does not get better with opioids. They say, well, I don't even know why I'm taking those opioids. Morphine, oxycodone, oxycontin, and all those things, tramadol, buprenorphine, they don't touch the pain. No, actually, they can make the pain worse over time. So initially, you may take the opioid, maybe the pain was better because it was nociceptive, neuropathic in the beginning, but later, when the pain transforms to nociplastic, you take the opioids, doesn't really make a big difference. You just keep taking it because probably you have withdrawals if you stop taking, and nobody likes to feel withdrawals. But over time, the opioids make nociplastic pain worse. Now, if you take antidepressants like duloxetine, or if you take anticonvulsants, gabapentin, pregabalin for your pain, and your pain gets better with those medications, or amitriptyline, another antidepressant, nortriptyline, it means that your pain is neuropathic. So because neuropathic pain really gets better with those medications. Nociplastic pain, not that much. So you see, it's really important to know what makes your pain better or worse. The T in Socrates is, when do you feel it most? Because some pains, they fluctuate. They fluctuate on the day. Like some pains are worse in the morning. If you're pain like lumbar pain or gluteal pain is worse when you wake up in the morning, and it takes about an hour, 2 hours for you have that morning stiffness, maybe that's an inflammatory arthritis of the spine. This could be ankylosing spondylitis, rheumatoid arthritis, psoriatic arthritis. So you need to see a rheumatologist. If your pain is the same throughout the day, it's more related to your activity, if you sit too much, if you walk too much, then it's more mechanical, it's probably more muscles, okay? If your pain is okay during the day, but wakes you up in the middle of the night, you wake up in the middle of the night with a pain mostly in the bones, in the spine or in the lumbar spine. This could be an inflammation of the bones, could even be fracture or a tumor or an inflammatory process. Mostly if you don't have pain during the day and the pain wakes you up in the middle of the night. So it's really important for us to know what time of the day is worse. Also, is it worse with your menses, with the periods? If you are a woman, we need to know, because that may be related to the estrogens. Or is your pain related to the season? There are some pains that they are seasonal. They only happen in the fall or the spring. This example of this is cluster headaches. It's one of the worst types of headaches described in human race. And the person will have a lot of clusters. That's why it's called cluster headache. They have clusters of headaches, but during a season of the year. And then they spend the rest of the year okay. And then the next year they have clusters of terrible headaches again, but it's always the same season. So it's really important to know the time. That's the T, okay? So we talked about the ameliorating factors, the exacerbating factors. So the last one is the severity of pain. And we don't have a thermometer to measure how much pain you are feeling. We don't. I think we'll never have, because pain is so subjective, and your pain is also the intensity of your pain depends on your previous experiences with pain, depends on how you're feeling on that day. Are you more stressed, less stressed? Depends on how you slept the night before. Depends on, a lot of times, it does not relate to the amount of injury. Believe it or not, a severe pain, and we ask the patients to give us numbers from 0 to 10. I really don't like that scale, but we don't have anything better. 0 is no pain at all. 10 is the worst pain that you can imagine. Give me a number. Believe it or not, if a person gives me a number 8, 9, 10, it doesn't mean that they have a more severe injury, damage, disease than someone who gives me a number 1, 2, or 3. Okay? Annette, is this what you want me to repeat? Annette said, can you repeat that? Is that clear now, Annette? And I can give an example. And I talk about this in the first pages of my book, I give lots of examples how this happened. For example, a person may have a cancer in the liver. You know, the liver is a big organ. They may have cancer in the liver. They have no pain, or maybe a tiny pain. A person may have ovarian cancer in the ovaries, big. Sometimes the tumor is big like this. They don't have any pain. Sometimes a person may have a stroke. Stroke is very serious. It's a lack of oxygen in the brain. They have no pain. Or sometimes a little headache. If there is a bleeding in the brain, yes. If it bleeds, it will irritate the meninges, the membranes, and it will hurt a lot. But if it doesn't bleed, it's just lack of oxygen, it doesn't hurt. On the other hand, a person they come to emergency with a 10 out of 10 headache, or 10 out of 10 lumbar low back pain, or a 10, sometimes they say my pain is 11 out of 10, but they don't have any serious injury. A headache, like a migraine, is not a serious injury of the head. It hurts. It may hurt 10 out of 10, but migraine doesn't cause any damage to the brain. It's just pain. A muscle pain can be 10 out of 10, but you're not going to die of a muscle pain. So when the person gives us the severity of pain, a number, if they tell me, Dr. Furlan, my pain is 8, 9, 10, 11, 12, whatever, that for me is how much they are suffering from that pain, how much that is worrying them, how much is the confusion in their head, because they are very afraid of that pain. That's what it is. They are very tired of that pain. They are very overwhelmed with that pain. That's what the number mostly is. And it's very subjective. And it's not your fault. If your pain is 10 out of 10, I believe you have a 10 out of 10 pain. And I need to treat your suffering. I need to treat your pain. I need to find where it is. And I need to calm you down and clarify, this is not a life-threatening thing. I examined you, and you're not going to die of this, or you're not going to become deficient, disabled because of this, okay? Yeah, so please do not put your symptoms here in the chat. I'm sorry, Nishant, I can't provide medical advice individual. So please don't put details about your pain here in the chat, because I'm not able to provide any individual advice. So that's basically what the Socrates is. And again, this handout is on my website. You can go to the page. Can you put again, Giovanni, the page where it is? It's www. If you are a member, are you already a member of my website? It's free. You go to my website, www.drandreafurlan.com. Yes, thank you, /explaining. And you just create an account there. And then you can download the PDF of this and print at your home. And after this video is edited and will be on YouTube forever, my assistant will put the link to this video on that part of the website too. So you can rewatch the video and you can download the printout. And don't forget to buy my book, The 8 Steps to Conquer Chronic Pain, because on page 44, you have basically everything that I explained here in this live. It's on the Socrates Method. So here on this chapter, I talk about, I have some examples of pain diagrams, you see. So I talk about different pain diagrams, what they mean, and so what the doctor will ask you, and how you should answer the doctor when they ask you for you to explain how is your pain. Yes. Okay. So let me take a look at the comments here, and then I will tell you about why October 5th is so special in my life. I'll tell you in a few minutes. Let me just see the comments here. Yes. Okay, Saturday noon or to 1 p.m. is good for people. So it seems that you guys like a Saturday. Yeah, thank you, Annette. So you understand now. Okay, so Saturday. So if I have to do more lives, I will let my members first. So if you become a member of my website, you will be alerted when I would do more lives like this. I tend to do a newsletter once a month, and then you get to know when I do that. The next live. So I think I'll do Saturdays again, because it looks like Saturday is great at 1 p.m. Okay, thank you, Nicole. That's good to know. Okay, so as I promised, I'll tell you, the October 5th, 1984. So 40 years ago. So today I'm celebrating 40 years that I and my husband, we started dating. Not when we got married. So that's when my husband and I, so we were just celebrating today 40 years that we have been together. We were dating, and then we got married in 1990. So today's, I hope tonight I can go on a dinner with him and then celebrate the 40 years that we are together. So that's why October 5th is so special for me. Thank you so much, Steph. Thank you. Good. So that's the end of our live. If you like to leave any comments, thank you. Thank you so much, Disha. Yeah. Okay. Yes. I hope you like the book. Thank you so much. Yeah. Thank you, Nadia. Yeah. And yeah, I'm spending this special day with you guys. Yeah. Thank you so much. Okay. So that's the end. Thank you so much for watching today, and I hope to see you again in the next live or when I post a new video. Don't forget to write your comments, and you can leave your comments here. Bye.